Welcome, everyone. Today, we're going to explore an important topic in diabetes management, diabetic ketoacidosis, or DKA. On this first slide, we have the title of our presentation. We'll be diving into what DKA is, its causes, symptoms, and how it's managed. I'm excited to guide you through this vital subject, so let's get started. Let's look at our first case, the lethargic teen. We have a 17-year-old girl with type 1 diabetes who arrives at the ER. She's exhausted, and she's vomiting, which immediately raises concern. She admits that during exam week, she skipped her insulin doses, which is a common issue but can be very dangerous. Her breathing is deep and rapid, what we call Kussmaul respiration, an important sign of metabolic acidosis. When the body tries to get rid of excess acids, breathing speeds up significantly. If you notice a faint fruity odor on her breath, that's a classic clue. It's caused by acetone, a type of ketone, which indicates her body is breaking down fat for energy due to lack of insulin. This case highlights how skipping insulin can lead to diabetic ketoacidosis, or DKA, which is a medical emergency. It's crucial to recognize these signs early so we can intervene effectively. Let's take a closer look at case 2. The tired traveler. This involves a 45-year-old man who has type 2 diabetes and has recently started insulin therapy. Now, he's presenting with some concerning symptoms: fever, dehydration, and confusion. These signs suggest that something more serious may be happening. His blood glucose level is alarmingly high at 420 mg/dl, which indicates severe hyperglycemia. Additionally, his urine tests are positive for ketones. The presence of ketones points toward the development of diabetic ketoacidosis, or DKA. This case highlights how, even with insulin therapy, diabetic patients can develop complications if their condition isn't carefully managed. The combination of high blood sugar, ketones, and symptoms like dehydration and confusion signals a medical emergency that requires prompt attention. Throughout this presentation, we'll explore the pathophysiology behind these signs and how to recognize and manage such situations effectively. Let's look at this case of the overwhelmed mother. Imagine a 30-year-old woman who suddenly collapses at home and is rushed to the hospital. When she arrives, she's breathing heavily, feeling cold, and her blood pressure is dangerously low, indicating hypotension. The monitor shows her blood sugar is above 500 mg/dl, which is extremely high. Additionally, she has severe acidosis, meaning her blood is too acidic. This scenario highlights how severe hyperglycemia can quickly become life-threatening if not managed promptly. It's a clear example of diabetic ketoacidosis, or DKA, where insulin deficiency leads to high blood sugar and acid buildup in the blood. Understanding these signs and symptoms is crucial because they remind us how urgent the situation can be. Recognizing when a patient is overwhelmed by their condition helps us intervene early and prevent tragic outcomes. This case ties into the overall theme of the importance of timely diagnosis and treatment in diabetes emergencies. So let's talk about what diabetic ketoacidosis, or DKA, actually is. It's an acute and potentially life-threatening emergency that can happen in people with diabetes. The main cause is insulin deficiency, which means the body isn't able to use glucose properly for energy. When this happens, several dangerous things occur simultaneously. First, blood sugar levels become very high, leading to hyperglycemia. At the same time, because the body can't get enough glucose into the cells, it starts breaking down fats for energy, which produces ketones. This buildup of ketones causes a state called ketosis, and it also results in metabolic acidosis, making the blood too acidic. Most commonly, DKA is seen in individuals with type 1 diabetes, since they rely heavily on insulin and can experience sudden shortages. However, it can also occur in stressed situations for people with type 2 diabetes, such as severe infections or other illnesses. Understanding DKA is crucial because it exemplifies how insulin deficiency can lead to severe metabolic disturbances, which ties into the overall importance of proper diabetes management and early recognition of complications. Let's delve into the pathophysiology behind diabetic ketoacidosis. When there's insulin deficiency, the body's ability to utilize glucose effectively is impaired, leading to increased lipolysis or fat breakdown. This process releases excess fatty acids into the bloodstream. These fatty acids are then taken up by the liver, where they are converted into ketone bodies, specifically acetoacetate and beta-hydroxybutyrate. The accumulation of these ketones causes the blood to become more acidic, resulting in a metabolic acidosis, a key feature of diabetic ketoacidosis. At the same time, the high blood sugar, or hyperglycemia, causes osmotic diuresis. Essentially, the excess glucose draws water out of cells and into the urine, leading to increased urination, dehydration, and loss of electrolytes. All these processes are interconnected and contribute to the complex clinical picture we see in diabetic ketoacidosis. Understanding this pathophysiology helps us grasp the severity of the condition and guides us in managing it effectively. Let's take a closer look at the key clinical features we might observe. First, patients often present with polyuria and polydipsia, which means they are urinating a lot and feeling extremely thirsty. Dehydration is also common because of the fluid loss. Along with these, nausea, vomiting, and abdominal pain can occur, signaling that the body's trying to cope with a serious imbalance. Another characteristic feature is Kussmaul respiration, which is deep and rapid breathing. This is the body's way of trying to get rid of excess acid. You might also notice a fruity odor to the breath, which is a classic sign of ketoacidosis. In more severe cases, altered consciousness or even coma can develop if the condition worsens. Recognizing these symptoms early is crucial because they highlight the body's response to a significant metabolic disturbance, often related to uncontrolled diabetes. Understanding these features helps us identify and manage diabetic ketoacidosis promptly, preventing further complications. Now, let's take a closer look at some of the common triggers for diabetic ketoacidosis, or DKA, which we often refer to as the 4 I's. The first is infection. Infections, whether it's a urinary tract infection, pneumonia, or any other type, can really throw off the body's balance. They increase stress hormones like cortisol and adrenaline, which in turn raise blood sugar levels and make insulin less effective. This sets the stage for DKA to develop. Next, we have insulin omission. Sometimes, patients might forget doses, intentionally skip insulin due to fear of hypoglycemia, or face access issues. Missing insulin is a direct pathway to DKA because without enough insulin, glucose can't enter cells, and the body starts breaking down fats for energy, producing ketones. The third trigger is infarction, which includes myocardial or cerebral infarctions, heart attacks, or strokes. These events cause significant physiological stress, releasing hormones that oppose insulin action and elevate blood glucose, thereby increasing DKA risk. Finally, intercurrent illnesses like pancreatitis, surgeries, or stressful conditions can also trigger DKA. These illnesses activate the body's stress response, releasing hormones that antagonize insulin, leading to elevated glucose and ketone production. Understanding these triggers is crucial because many of them can be anticipated or managed with proper care, helping us prevent DKA in our patients. Recognizing these common scenarios allows for proactive intervention, which is key in the overall management of diabetes and its complications. Let's walk through the core management principles for treating this condition. First, fluids come first. We typically start with normal saline to restore the patient's volume, because addressing dehydration is crucial at this stage. Once we've stabilized the volume, the next step is insulin therapy. But it's important to administer insulin via IV infusion only after we've evaluated and confirmed the patient's potassium levels. This helps prevent dangerous shifts or hypokalemia. Speaking of potassium, we need to correct any deficiencies as needed, replacing potassium carefully and based on lab results. Finally, bicarbonate therapy is reserved for more severe cases, specifically if the drops below 6.9. Always remember, these principles are interconnected and form the foundation for safe and effective management. Let's talk about some complications to watch for when managing conditions like diabetic ketoacidosis. First, cerebral edema is a serious concern, especially in children. It can develop rapidly and lead to increased intracranial pressure, so close monitoring is essential. Next, during insulin therapy, hypokalemia can occur. Insulin drives potassium into cells, which can cause dangerously low potassium levels in the blood. We need to monitor potassium closely and replace it as needed to prevent arrhythmias or other complications. Finally, hypoglycemia during the correction phase is a real risk. As we restore blood glucose levels, there's a chance they could drop too low if we're not cautious. That's why gradual adjustments and frequent blood sugar checks are critical during this phase. All of these points highlight how delicate the balance is in treating these patients. Staying vigilant helps us prevent these serious complications and ensures a safer recovery process. Let's go through the mnemonic for DKA management, FIKB rescue. This is a handy way to remember the sequence of steps we need to follow. First, F stands for fluids. Rehydration is crucial because patients with DKA are usually dehydrated due to osmotic diuresis. Next, I is for insulin. Administering insulin helps to lower blood glucose levels and stop ketone production. Then, K represents potassium. It's important to monitor and replace potassium carefully because insulin therapy can cause a shift of potassium into cells, risking hypokalemia. Finally, B stands for bicarbonate, but only if the acidosis is severe. Bicarbonate therapy isn't routine and should be used cautiously, mainly in cases of severe acidosis. Overall, this mnemonic helps us organize our approach clearly and efficiently, ensuring we don't miss any critical steps in managing DKA effectively. Imagine you're a stranded diabetic camper, feeling pretty rough. You're dehydrated, so your skin feels dry. Your breath has that fruity smell, which indicates the presence of ketones. And you're breathing fast because of acidosis, trying to blow off excess acid in your body. Now think of the rescue team arriving. Let's call them FIKB. They come prepared with the essentials: fluids to rehydrate, insulin to lower blood sugar, potassium to correct electrolyte imbalances, and bicarbonate to help neutralize the acid. This visual memory trick helps us remember the key steps in managing diabetic ketoacidosis. Rescue with fluids, insulin, electrolytes, and bicarbonate, each playing a crucial role in restoring balance. It ties back to the overall theme that prompt, targeted treatment is vital in emergency situations like DKA. Let's talk about a key clinical pearl when managing diabetic ketoacidosis, or DKA. First and foremost, fluid resuscitation is the very first step you should take before starting insulin therapy. Restoring volume is crucial to stabilize the patient and prepare them for further treatment. A common trigger for DKA is infection, so always keep that in mind when evaluating a patient presenting with diabetic emergencies. Identifying and treating any underlying infection is vital to resolving the DKA episode. Now on to some classic signs you might observe. Kussmaul respiration, which is deep, rapid breathing, is a hallmark of DKA. It's your body's way of compensating for the metabolic acidosis. Also, fruity breath odor is another classic sign. This is due to the presence of acetone, a type of ketone, in the breath. Understanding these signs and the initial management steps helps ensure prompt, effective care for patients in DKA. Let's wrap up with a quick summary of diabetic ketoacidosis, or DKA. As we discussed, DKA is characterized by a combination of hyperglycemia, ketosis, and acidosis. These are the key features that help us recognize the condition. It typically occurs due to an insulin deficiency, which impairs the body's ability to use glucose properly, and stress triggers that can worsen the situation. Managing DKA involves a multifaceted approach: administering fluids to rehydrate, providing insulin to correct the metabolic disturbances, and replenishing potassium levels as needed. Close monitoring throughout treatment is essential to ensure everything is stabilizing. Most importantly, we always need to treat the underlying cause, whether it's missed insulin doses, infection, or other stressors, and take steps to prevent recurrence. This comprehensive approach helps us effectively resolve the current episode and reduce the risk of future episodes.